Hello everyone. Today we'll discuss another important MCQ, and this is especially USMLE based multiple choice question. The question is, a 26-year-old man present to the clinic complaining of intermittent muscle cramping for the past 3 months. Okay. On physical examination, his BP is found to be 190 by 110 millimeter of mercury. Blood is drawn, and this reveal is sodium level is found to be 155 milliequivalents per liter. Okay, and potassium level is about 3.2 milliequivalents per liter. Bicarbonate levels 33 milliequivalents per liter. Okay, otherwise the extended metabolic panel and the complete blood picture are normal. Okay, so, what is the most likely cause of this patient findings? Okay, option number 1, Addison's disease, 2, Cone syndrome, 3, Cushing syndrome, fourth one, hyperparathyroidism, and fifth one is pheochromocytoma. Okay, there are 5 options are there. Coming to the Addison's disease, okay, it is due to the deficiency of aldosterone. Okay, so the signs of aldosterone are hypotension, okay, hyperkalemia and hyponatremia. Okay, these are important features of Addison's disease due to the deficiency of aldosterone. But here BP is increased, hypertension is there, potassium level 3.2 milliequivalents per liter, so hypokalemia, and bicarbonate level 33 milliequivalents per liter. Okay, that is elevated bicarbonate levels. So Addison's disease is ruled out because there is a hypotension in case of Addison's disease. Coming to the Cushing syndrome, you know that this Cushing syndrome occurs due to the elevated cortisol secretion. Excessive cortisol secretion occurs in Cushing syndrome, and this elevated cortisol, okay, it also produces hypertension. Along with that, it produces moon face, truncal obesity, and skin hyperpigmentation. Okay, these are all the features of Cushing syndrome. But here BP increased, but no other feature suggestive of Cushing syndrome like truncal obesity, okay, moon face, and skin hyperpigmentation. Okay, next is hyperparathyroidism. This is due to the elevated calcium level. So this elevated calcium level causes depression, constipation, and osteoporosis or bone fractures. Along with that, renal insufficiency, kidney or renal stones will be there in case of hyperparathyroidism because of elevated calcium level. But all these features are not explained in the above condition. In pheochromocytoma, it is due to the excessive secretion of catecholamines from the adrenal medulla, and it produces some of the symptoms, remember, like 5 P's, that is elevated blood pressure, P for elevated B, blood pressure, and another P, palpitations, perspiration, okay, pallor with diaphoresis, and pain in the head called headache. These are the features of pheochromocytoma due to the excessive secretion of catecholamines like adrenaline, noradrenaline, etc. So hypertension will be there, but no headache, no perspiration, no pallor, okay, no palpitations. So pheochromocytoma is also unlikely in this case. Remaining condition called option 2, Cone syndrome. It is also known as primary hyperaldosteronism, means excessive secretion of aldosterone. It is due to the solitary neoplasm of the adrenal gland, especially in the adrenal cortex. So because of this, okay, this excessive aldosterone causes more water and sodium retention. Okay, because of this excessive retention of sodium and water leads to hypertension. Okay, along with that, increased potassium excretion, that is called hypokalemia. Here 3.2 milliequivalents per liter is there, hypokalemia. Because of hypokalemia, the patient experiences intermittent muscle cramping from the past 3 months. Okay, other thing is sodium levels are increased. Cone syndrome because of aldosterone, excessive retention of water. So hypernatremia will be there, 155 milliequivalents, and more excretion of potassium, hypokalemia. Along with that, elevated bicarbonate levels in the body, that is 33 milliequivalents, it is causes metabolic alkalosis. So hypertension, hypernatremia, hypokalemia, and other one is metabolic alkalosis. These are the classical features of primary hyperaldosteronism known as Cone syndrome. So the probable reason for these findings in the patient, it could be the Cone syndrome, and also decreased renin levels is associated with Cone syndrome. So in this case, option number 2 is the answer. Okay, thank you all.